Welcome to UPLEVEL, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna. I spent years crafting ways to help women thrive, and I want to help you do the same. On this podcast, we dive deep into health at every level, focusing on the mind, the body, and the spirit. This is where real conversations meet transformational wellness. We'll be talking about all the things that truly matter, from nutrition and fitness to lifestyle, mindset, and personal development. Plus, the real deal on managing stress and navigating menopause. So if you're ready to elevate your health journey with authentic, transformative insights, you're in the right place. Let's get started. Hello, and welcome back to UPLEVEL. I'm Dr. Jenna, and today we're going to talk about all things inflammation. Inflammation and its relationship to hormones, hormones and its relationship or their relationship to inflammation, etc. Because I think most of us can relate to, at some time, feeling more achy or bloated or more reactive than we used to be. Does this resonate with anybody? Like, we're not imagining it. Inflammation and hormones are deeply connected, especially in midlife. And, this is for everybody, but especially for my women in midlife, we start not feeling quite like ourselves. I'm like, why am I more bloated? Why am I more achy, etc.? So we're really going to look into what is driving inflammation, what we can do about it, how often it's missed, because there's acute inflammation, and that's a healthy response. That's a short-term healing, healthy response. And then there's chronic inflammation, long-term inflammation, which can cause long-term damage. It's linked to heart disease, diabetes, autoimmune conditions, weight gain, brain fog, depression. The list goes on. And so one of the things that's tricky, you've heard me talk about listening to our bodies. All of these symptoms that we have are like we're seeing the tip of the iceberg of what is underneath all of these various symptoms, what's underneath the surface that's really driving them. Because inflammation has been brewing for a while before it shows up. There's things not working properly in your body for a while before the cholesterol shows up as off on your labs. So it doesn't usually show up like an ambulance with all its alarms going off. It kind of whispers first. And this is our symptoms. There's the body communicating with us. They're whispering to us. It's going to whisper before it shouts. Just like if we manage our emotions and we have something that comes up that upsets us, we can maybe calmly tell someone. But if it brews and brews and brews, we might end up shouting before they even had any idea that there was anything going on. So for a lot of women, it starts with the things we tend to brush off. And that's why I feel like this topic is so important. Period pain that we've been told is just normal. It's common, but it's not normal. It doesn't have to be that way. Chronic aches, chronic fatigue, or just fatigue in general, bloating, gut issues, eczema, allergies, even the stubborn weight that won't come off, restless nights that keep adding up that we're just chalking off to stress or to age. And the thing is that in conventional medicine, we're often told, like with conventional practitioners, that there's not much we can do. Our health is basically out of our hands. We can't help our immune system. If you have autoimmune, you're going to have it for the rest of your life, or it's all genetics. And this really takes our power away from how much control we do have over our own health, which is how I got into this field to begin with. I was a theater major. I don't remember if I ever told you all this story, but I was a theater major and we didn't have understudies. And so we were given a sheet of paper saying, like, if you get sick, here's what you have to do. And it was like, get enough sleep and take this and eat this way. And I remember thinking, I was like 19 years old. And I thought, well, if these behavior changes and these dietary changes and these, certain supplements or herbs or whatever are beneficial for me when I'm sick, what impact might they have if I implemented some of these things when I'm healthy? And that was when I realized how much power we have over our own health. Even genetics are turned off or on by the environment, by the way you eat, by the way you take care of yourself. So the truth is, research is saying something very different than, hey, there's nothing you can do, or it's just age, or it's just XYZ. And, depending on who you ask, a very large percentage, let's say 80 to, I don't know, even upwards of 90+% of chronic diseases, even the big ones like diabetes, heart disease, dementia, are preventable. They're not just destiny. So that doesn't mean we can control everything, but it does mean we have far more influence than we've been led to believe. And hormones are right in the middle of that picture. And with diabetes, for example, there was a study where they added up all of the costs and all of the time that it would take to prevent diabetes. So shopping for healthy food, prepping food, exercising, like all of those pieces, the time and money to prevent diabetes, and the time and money once somebody had diabetes to turn it around. And it costs, they found in this study, twice as much time and twice as much money to begin to turn diabetes around than to prevent it in the first place. So just like your car, you don't wait till you've used up all the oil in your car and you start burning out your transmission. You got to change the oil. You got to take care of it. This is our vehicle. Let's take care of it. So as we move through midlife, as our estrogen is declining, it is not just about hot flashes and mood shifts. It directly affects inflammation. CRP, or C-reactive protein, which is a key marker for systemic inflammation, rises after menopause. We test high sensitivity CRP on all of our patients because it shows an increased risk for cardiovascular disease when this is elevated. And we know that in midlife, our risk for cardiovascular disease increases. And we were sort of behind men in the rates, and we catch up around menopause. So low estrogen is going to amplify those inflammatory responses, and other hormones like cortisol, our quote unquote stress hormone, can add fuel to this fire when chronic stress is in the mix. So lifestyle matters too. We're always end up talking about the same thing. So I hope you start to see the patterns. Poor sleep, lack of movement, processed foods. These all exacerbate inflammation. But here's the empowering part. Always the empowering part. Simple evidence-based strategies can make a huge difference. So remember, these small signals early on, just like in a relationship, you don't wait when these things are adding up. You want to address them. So the subtle aches, the digestive issues, the skin changes. Don't wait until they compound into bigger problems. Tune in early and support your system. Support your hormones and help prevent inflammation from really taking hold. All right. And back to the idea of, I just want to throw in high sensitivity CRP or HSCRP. These are rising across menopause. And we see this in many studies, and there's some other inflammatory markers that rise. So again, these whispers before it becomes like a full out fire, if you will, or screaming match. So estrogen, naturally anti-inflammatory. It declines after menopause. It's going like up and down, up and down, up and down in perimenopause, right? Which is why we often feel a little insane. And then it's on a steady decline after menopause, which leads to those higher inflammation markers like CRP and cytokines. Now, also women with genitourinary symptoms, which is very, very common and not treated when it should be. Again, so many women are like, they're just told to deal with it. It's very upsetting. CRP in these women was nearly 5 times higher compared with those without symptoms. So this suggests that there's local and systemic inflammation potentially tied to the estrogen decline. We can address these things in a variety of ways, which we're going to get into in a moment. But I'm a big fan of vaginal estrogen. If a woman has genitourinary symptoms, chronic urinary tract infections, vaginal atrophy, pain with intercourse, and it's as I said, it is not contraindicated in a history of cancer, and it's very, very helpful for those women. Now, again, talk to your doctor, your provider, have a menopause educated, menopause literate provider. I'm not giving you medical advice, just telling you what the research shows. Progesterone, which is also declining in this time, progesterone calms our immune response and helps balance and keep us in rhythm with estrogen. Cortisol, that stress hormone, when it is dysregulated, it keeps the body in that fight or flight on mode, which raises systemic inflammation. So if you've just been taking care of everybody else and go, go, go and eat on the run and all those pieces, that chronic stress can lead to chronically elevated cholesterol, which leads to systemic inflammation. And then insulin plays a piece in this as well. And so many of the people that I see in my practice, their insulin is not ideal. So we have blood sugar swings and insulin resistance, and these things drive inflammatory cytokines as well. So when we look at these key drivers of inflammation, they're really heightened in midlife. Blood sugar and metabolism. We get elevated glucose from stress. Insulin resistance is going up, equals chronic inflammation. Visceral fat, that belly fat that we hear women talk about all the time. It is metabolically active and it pumps out inflammatory chemicals. Stress, cortisol dysregulation. Again, constant fight or flight, keeping the immune system fired up, which is why a lot of us can't sleep. Like the hormones that are going out of whack affects our sleep, but just that also fight or flight, sympathetic nervous system can't shut down to go to bed, can't quiet the mind, leads to sleep disruption. And sleep disruption has a huge impact on our hormones and on our inflammation. Just one night of poor sleep increases CRP and other inflammatory markers. And when this is chronic, this becomes a major issue. So sleep is not just about rest. It's immune regulation. And in menopausal women, those with poor sleep quality showed significantly higher CRP and metabolic markers than those who sleep better, independent of other factors. So this is a big deal. And insomnia and low sleep efficiency, low sleep quality are strongly correlated in broader studies that they've done with these elevated inflammatory markers. So you can see how this all ties in, because poor sleep will disrupt your hormones. Your disrupted hormones from stress will affect your sleep. And then if your sleep is disrupted, we often don't eat as well. I had a whole podcast looking at that, or at least a large part of the podcast. And then so diet, processed foods, refined carbohydrates, sugar, they have a clear inflammatory impact. And when we don't get as much sleep, we tend to crave those processed foods more. There's also environmental exposures. I was gonna talk about something else there, but I'll maybe touch on that later. We'll see. But endocrine disruptors like phthalates, like BPA, these are emerging contributors. The evidence isn't as strong as diet, stress, and sleep, but there is preliminary evidence that these are endocrine disruptors and can lead to contributing to this inflammation or this inflammatory pattern that we see. So what are some practical things that you can do to lower inflammation? All right. And again, I'm just going to talk about what both the research and experience has shown, because I believe that understanding these connections empowers us. And the moment we feel helpless, the moment we feel like we can't control something, that can really affect our mood. That can, without hope, that leads to, depression and just feeling stuck. And then we get in a negative thought pattern, which can further add to this process. So I've mentioned these in the effect of them not being in balance. So let's talk about sleep. Prioritize quality sleep. Simple sleep hygiene tips. And I have a few episodes on sleep. Just 6 to 7 hours of quality sleep can reduce your inflammatory markers significantly. So getting off those screens before bed, having blue light blockers, having an evening routine where you're taking a bath or you're winding down or you're doing a gratefulness journal, whatever works for you to really help you with your quality sleep. That will then also help you, ideally, and should, with a balanced diet. Meals that are whole food based, high in fiber, omega-3s, phytonutrients, and other anti-inflammatory nutrients. This all matters. And remember, when the gut is dysregulated from hormones, from stress, when the microbiome is off, which is a huge topic that we're just tapping into in the research, this is going to make it hard to absorb your nutrients. So when we manage stress and we sleep well and we start repairing our gut, we're going to absorb these nutrients. So we want to eat the nutrients that are healthy for us and have the fiber, which is also going to clear, the fiber is going to help clear those endocrine disruptor toxins and environmental exposures from the gut. We are also going to absorb better because our gut is in a better place. So it's more about overall pattern and quality. It's not about being perfect. It's not about having a pristine diet. It's not about never going out to eat. And this is going to be polarizing. Warning alert. This is one of my issues with this idea of quote unquote, like cleaning up our food, getting the dyes out of the food, and whatnot. I totally support that, but it's still about a bigger pattern. Which foods tend to have the dyes? The crap processed food. So yes, is it great if we get dyes and other chemicals out of our processed food? Yes. Is it better if we stop eating those foods? 100%. And so sometimes we get focused and micro-focused. And I think it was in my conversations with my director, Allie, we talked about demonizing certain foods and demonizing certain, whether it's like demonizing sugar or demonizing seed oils or demonizing oxalates. Right now, this is probably the most polarizing part. There's a big push on social media to blame seed oils for everything. And I hear from people, oh, I got rid of the seed oils and I feel so much better. Studies don't actually support this. I'm going to lose some followers with this. But again, that's not even my point. If you want to avoid seed oils, all right? But in the cultures, there's cultures that are incredibly healthy that are using seed oils in their food. But it's about the overall pattern and quality. Their overall eating is healthy. And so we often want to blame one thing and go after it. And even with your health, hormones, right? That's a buzzword today. Balance of hormones. I mean, I'm here talking about hormones. Hormones are super important. But if you're super stressed, it's not just about those like menopausal hormones. If you're sleeping poorly, like there's still a bigger picture. And rarely do I find that a health issue is one thing for someone. We can just nail it down. This is that one cause. That's the exception. It's usually, even with health, about the overall pattern and quality that's driving whatever disease process we have. So I think we can look at this in a positive light of, okay, I don't have to freak out about every little detail, every little exposure, but really focus on my overall pattern, my overall quality. When I go to Disneyland with my family, and I like to have the churros, but I don't eat eggs, and most of them have eggs in them. But let's say I find an egg-free churro. Is it crap wheat and crap sugar that they've made it out of? Like, probably. But yum, I want to enjoy that and not have it have a huge impact on my health because my overall pattern and the overall quality of what I'm eating is high. And even when I'm in Disneyland, I've got my protein powders, I got my green powders, I have my red powders, and I'm doing all that in the morning before we start our day. So no matter what I'm exposed to later in the day, I've got a solid foundation. So again, one meal can make a difference. Okay, I got off on a diet tangent. Which brings me to the next point, balancing blood sugar. So you're going to balance blood sugar with a whole food diet, with lots of fiber, with having healthy meals. But we want to make sure you're having lots of protein and smart carbohydrates, right? Not churros all day long, but complex carbohydrates. And these have a slow release and they're high in fiber and they're high in nutrients. So not the processed foods. We got to move our bodies. I know some of you are too tired and too in pain. And that's why when you start getting better sleep and working on your diet first, then you might be able to start moving your body more. Resistance training and moderate aerobic activity, they help modulate inflammation. I feel like a broken record sometimes, bringing back all these same things, but these are the pillars. These are the pillars of health. If you have a stool and you have 1 of 4 legs, you are going to fall over. If you have 2 of 4 legs, you probably still fall over. We got to start building those pillars of our stool, of our body. So these are going to help modulate inflammation and improve hormone signaling. So strength training and walking both lower inflammatory markers. And then again, especially if you walk in nature, then you're going to get the benefits of nature and a nice gentle walk. And this is one of the ways we can manage stress, which is another key thing we can do for inflammation. Stress management. Chronic stress keeps your cortisol high. Likely going to contribute to sleep issues, mood issues. You may not feel hungry. So you're going to further dysregulate your blood sugar because when the cortisol is high, it's run from the bear, your blood sugar is high, and all of this perpetuates inflammation. Could add to belly fat. So do your mindset work. Do your meditation or prayer or whatever that looks like for you. Even a 5-minute daily pause can help. 5-minute daily pause. So I have other episodes on stress management practices, breath work, journaling, nature, meditation, movement, okay? And then lastly, we absolutely, of course, can address hormone imbalances with MHT or menopausal hormone therapy or natural support, depending on your particular situation. This can restore the protective effects of estrogen. So again, work with a provider that's well-trained in menopause. As remember, your conventional providers are not. The stats are terrible on the education in med school for understanding how to help menopausal women. And if hormone therapy is appropriate for you, it can be super, super helpful, but not at the expense of other things. It's not a magic bullet. If you take hormone therapy and you eat like crap and you don't sleep and you don't move your body, may it still help you? Sure. But you're still driving inflammation in other ways. So again, the whole picture. But when supported, and I have a whole episode on sort of when that goes through MHT, menopausal hormone therapy, or often known as BHRT or HRT. The name has changed over the years, but to look at the myths around it. So if you don't know, like, is this right for me? You have to find a good practitioner to work with, but you can start with that episode and learn more. So again, understanding all of these connections, I believe, empowers us. And what I will say is small daily choices create huge downstream benefits. Remember, success is just a series of small wins stacked up over time. Not about perfection. Let that go. Join the Recovering Perfectionist Club. It's about awareness. It's about consistency. And consistency doesn't mean perfection. It can mean you just keep showing up. You slip, you fall, you get back up. You have a churro, then you have a nice meal, whatever that looks like for you. So to close, inflammation is not about just one villain. I'm always leery when we talk about anything being about one villain. All right. It's not just about carbs. It's not just about hormones. It's not just about various chemicals. All of that can play a part, but it's about imbalance. When hormones and metabolism and lifestyle and stress are blah, or when they're aligned. How's that for medical terminology? When they're blah. When your hormones and your let's do this on the positive. When your hormones and your metabolism and your lifestyle and your stress align in an intentional way in a positive direction, inflammation can calm down. You can start to feel better. Your mood will even improve. So inflammation isn't a huge mystery, but it is important to understand that it's not really talked about in a way that's empowering in conventional medicine. There's not much we can do. We brush off these symptoms. This is just normal. Hey, welcome to midlife. You're going to feel like crap. Our health is out of our hands. This isn't true. And so we want to listen to these small signals, and we want to understand that it's not inevitable. It's not inevitable to have chronic inflammation and to be dragged into your 90s. All right. When I lived in Boulder, I was, hiking up the Flatirons at 10 in the morning and there were 90-year-olds on their way down. And I thought, that's how I want to be when I'm 90. Okay. So hormones, sleep, stress, lifestyle, they all influence how our body responds. So when we notice these subtle signs, we make small adjustments. Don't overwhelm yourself because you'll be paralyzed. Oh, I got to do all the things. Pick one thing from this episode you're going to focus on, because if you try to do too many things, I don't know about you, but like if my house is too messy, I can't clean it at all. I mean, I can't, but I don't. I'm like, I get paralyzed versus, oh, it's not that far gone, right? Just pick one thing, small adjustments, support ourselves, ideally with evidence-based strategies. Don't hyper focus on one thing, and we can actually shift our health trajectory. We can shift our health trajectory. And stress takes its toll. Stress absolutely takes its toll on us. I remember when I was trying to conceive my second child and I had 3 miscarriages, and I was convinced I waited a little too long. I was in med school and residency my entire 30s. So I had my son in my later 30s, my daughter in my 40s. And I was convinced I had 20-year-old eggs because I was so healthy. I was like, I move my body and I eat well. I ate well through schooling, through residency. And I remember talking to my dear friend and amazing practitioner, Leslie Vogel, here in Sedona. And I said, so I went and I got assessed, and I thought he was going to tell me my eggs were super young. And it turns out my eggs were older. He said my eggs were biologically older than me. And I was like, how is this possible? And she said, you've been under a lot of stress. She said, you handle it beautifully, but stress is still stress. So again, I've worked on handling it even better, but we also, where can we simplify? Where can we minimize? Where can we stop people pleasing that's adding stress and feeling that we have to do something? All right. Start to simplify and get all that crap out of your life. All right. Because she was right. I went through my 30s in an intensely stressful environment. Did I handle it well? Yes, but it was still stress, and it did take its toll on my body. So your body is trying to communicate with you. Listen, respond, take action. And I promise you, your future self will thank you. So thank you all for joining me. Stay curious, stay empowered. Don't let anyone take away your power or tell you what you can or cannot do. Keep paying attention to the signals your body gives you. Because the truth is, when we support our bodies, when we support our hormones, when we support these changes that our bodies are going through, inflammation does not have to control us. I just want to finish with really emphasizing. I know I've said it. I'm going to say it again. I'm going to say it again. You have more control than you think. Every meal, every breath, every drink you choose, every night of rest, every moment is a chance to reset and turn down that fire. Take a new breath. Shift your mood. Shift what you're eating. That's why the only moment is now. So utilize it wisely. Thank you all so much for joining me, and I will see you next time. Thank you for joining me on this episode of UPLEVEL, Real Health, Real Talk. I hope today's conversation inspired you to take the next step in your health journey, one that nourishes not just your body, but your mind and spirit as well. Don't forget to subscribe so you never miss an episode. And if you found value in today's episode, please leave a review. Until next time, keep learning, keep growing, and keep thriving. And remember, true wellness is a journey, and you are on the right path.